Good evening, everyone. Is it evening or afternoon? The night is getting shorter or longer, the other way around. Thank you very much, particularly Professor or Professor Kim, inviting me here to meet up all of you. Well, the lecturing is certainly not my cup of tea. However, time to time, I take these opportunities to meet young students like you. Not much for giving a one-side lectures, but more on interacting with young spirit. Well, I do prepare some slide here, but it's not my intention to complete all the slides today. The more important thing is to really interact with you. Well, as long as my schedule allows, I enjoy this kind of the occasion. But particularly when I was invited by the international school, like here, with students from all over countries. Not only from AP, sometimes country from Russia or some Middle Asia. Because I was, as Professor O introduced, I was responsible for the Asia-Pacific region. My keen interest those days, until today, to be the first, the healthcare provider in every emerging countries. So, for example, we do have companies in North Korea. Can you believe it? We are the only successful foreign invested companies launched in Pyongyang. And we have our operation in Afghanistan, for example. And I have some story that I hire one gentleman, Afghanistan from Korea. He came all the way from Afghanistan to Korea to learn, to attend this kind of international school where we met each other. And it was really enjoying time to convince him to get back. First time, he didn't want to get back to his own countries. His intention was to stay in Korea. Finally, he was convinced. And now he is our representative residing in Afghanistan. Of course, he is one of the richest guy in Afghanistan, no question about it. That was already back 2007, I guess. That was one of my motivation to meet you coming from the all over countries. Perhaps who knows that you get back to your home countries to become kind of HD Kim in your countries. So maybe 10 or 20 years later, you become a CEO of Braun, so on countries. But at the same time, I had to realize that the people somehow love too much Korea. So you want to stay here in Korea rather than getting back to your home countries. Never mind, it's all your choice. Well, I've been in healthcare sectors for how many years? For 30 years. I'm the longest serving CEO for more than 25 years. How lucky guy I am. So I have nothing much to talk to you but the healthcare sector. So I'm going to guide you to our journeys to explore a little bit about healthcare industries. How the industry was in the past, how it is today, how it would look like in the future. Our group was born 1839. And after 174 years later, we became one of the leading healthcare providers. The Melsungen is in the middle of Germany, between Frankfurt and Hanover. Perhaps you know about which country is nearest? Never mind. So, well, 174 years, a little bit too old to have some kind of imagination. So let me give you some kind of feeling what happened those days. The scientific medical journal was first published 1 year later. Our company established. And still those days, there was no medical association in the United States. So which means that Europe means the whole world. And the biggest companies in Europe is the biggest company in the world. Which means that our company, until a couple of decades ago, we are number one. Well, number one, number two, that is not much important. For us, most important thing is that how long the company can sustain. We take the medicine. The history of medicine has been some 1,000 years, but the medicine has been counted for slightly less than 200 years, which means that our company has been developed together with the medical technologies. I cannot introduce all the technologies we develop, which changes the medical technologies. Therefore, I just introduce some the major the invention 100 years ago and 50 years ago. One of those are sutures. Any of you has a little bit of experience having stitch in your body? You? What kind of experience it was? I'm sure that it was not the best experience that you had. But only a few of you having a stitch, having a suture. So most of you are really lucky. You guess, the suture has been some 1,000 years. When the first surgeries, I have no idea when the first surgeries in the human body has been taken place, but observable sutures for the inner organ, the Braun was the first companies to introduce in the market. Horrible? Good appetite. The suture und crusher technology has been evolved as well for last how many 100 years. We have some kind of better alternative. You are lucky that you are born quite late. How about this? Taping technologies. we have a better solution. Just liquid glue. Now with these technologies, wound closures become a choice. So how much can you afford to pay not having a stitch? Don't worry, that was history. The future business, well, it has been already more than 100 years. Well, time is mature enough to disrupt. In fact, the future of this business is not that bright. The patient nowadays, particularly the young female patient, they don't like their body open widely. So they allow doctors to make a few pinholes. And ladies become more skeptical. That is not even no more acceptable. They allow to use existing wound, which is belly button, so that the patient has no longer wound. Even that is not enough. Now, the modern technologies somehow should manage to get into the stomach. From the stomach, it has to reach to the wound. This is not an easy job anymore. So doctors need a certain the equipment to handle this kind of surgeries. When those good days, the doctors were allowed to open widely, this microscope was a very strong tool to handle, to operate the wound. But those good days are over. This endoscope is introduced. Now, it's no longer the normal 2D endo. Now, it has to be 3D. So doctors has a distance to sharply operate, to cut or treat the wound. Here, the point is that we are the one who supply this beautiful, wonderful, the 3D endoscope. But company like, how many of you have heard about company called Zeiss Lights? Those are the big name. And their main business is surgical microscope. What will happen to them? How long they can sustain with a microscope? Maybe 10 more years. This is not five-star hotel. Such a surgery is taken place in these luxury rooms, so to say, digital oval theater. Until last year, I had a deep thought. whether this technology has to be developed in Korea. As you could easily see, the technology fits pretty much into the Korean, the IT technologies, all kind of screens and monitors and this and that. So I was about to decide, okay, this is the one that I have to develop in Korea by using the local technologies. Fortunately, unfortunately, I didn't decide that way, the other way around. Why? Anybody can guess why I didn't take that decision? Perhaps the Google Glass may disrupt all kind of monitoring technologies. I don't know whether that will be the case or not, but there seems to be a very, very high risk. So those days, maybe a couple of years later, in the OR room, there's no monitors at all. And any place where disinfection is guaranteed, the doctor or surgeon can operate. Because all the necessary data, the doctor keep monitoring through his Google Glass. I don't know whether it will be a Google Glass or a Samsung Glass, or that is not important. The important is the disruptive innovation now comes into the medical. And what happened for those companies which put the heavy investments in building these luxury equipments? It cost approximately half to $1 million to build this. And how much cost you should pay for the one Google Glass, I don't know. And approximately 50 years ago, the company developed IV catheters. Have you ever heard IV catheters? Anybody knows about IV catheters? No. Anybody knows syringes? You have another good experience with syringes. Syringes with needle. How many punctures could you remember in your life? Why you don't like to go to hospital? Simply because this. And sutures. So can you imagine, our company is not the favorable companies to the people. We are the one who invented all this kind of equipments. So whenever you go to the hospital, make sure that you got some injections. It's not the really best experience. So we introduced this IV catheters. It looks like this. Only one puncture. And take needle away. And very flexible, soft, what is it? The plastic remain in the IV vessel. It lasts one whole week. So whenever the patient needs injection, no puncture anymore. And all the IVs, the solution goes into the body through this little beautiful. Well, that is not a new technology. That technology has been developed 50 years ago, half century ago. The interesting thing is that we put little tiny tip here. What would be the purpose of this tip? Safety. Practitioner, the nurse who handle these needles, they get needle injuries so that they can easily impact it. So we just put little tiny tip here. And I was the one who produced that equipment. Can you imagine 400 million pieces a year? When I go there 10 years ago, we produced only 100 million pieces. And after 10 years, we are producing 400 million to supply all over the world. Average price per piece is €0.5 without tip, €1 with tip. So can you imagine how expensive that small tip is? The tip is just nothing. There's absolutely no difference in manufacturing cost. Well, this is company secret, but never mind. But we put the nice story. The practitioner, nurse, your safety is the reason of our existing. So that is our company mission. Your safety is our mission. With this story, we charge double the price. So we produce 400 million pieces, which means 400 million euro with just little single tiny little products. More sophisticated technologies. Have you ever heard stents? You guys must be extremely happy people. I'm sure one of your family member, more than one, had several stents in their bodies. What is stents? This is coronary artery. Time to time it blocks with clots of blood. And what happened? Then the heart stops. So until 2 to 3 decades ago, the most of patients with this problem passed away. No other choice. So a company like us introduced this mesh coil put into the vessel. The first, it comes with a balloon and inflated like this, and then took away with this balloon, then these supporters remain in the vessel. So this is the biggest market. I'm sorry that I'm using the market, but this is the biggest areas the people get the dangers in death. The problem is, here is the champion of stenting. "28 catheterization would last 10 years with 67 stents. He was put with 67 stents like this all over his arteries. So these patients are living. He survived in a way, but what means of survival? So we introduced this beautiful balloon with beautiful catchphrases. The best stent is no stent. So there's no stents. We just go the balloon with the drug eluted, and we put all the nice drugs into the vessel, inside of the vessel, and then we remove the balloon. Then all the drugs remains in the vessels to treat the disease. So such a wonderful the technologies save a lot of patients. So, since we are touching the healthcare sectors, there are 5 S megatrends. I take a little time to introduce just a little bit. Become more safer. So that is something that I just introduced. It's become more softer. So from the rigid sutures, it become the liquid, the glue. And technology will become smarter. That is the general trends, not only the medical. And it becomes smaller, all the way to the gene size, and it becomes more specific, custom-made treatment. Let's see. The doctors look like this way. Stethoscope is more than just hearing of symptom, but it works as a symbol of doctor, like this, or hang into the neck. But in the future, there will be no more stethoscope. Instead, the doctor will carry one of this kind of piece. What is it? What is it?
Kind of looks like a portable ultrasound.
Exactly. Ultrasound. Now, the Korea will soon introduce this ultrasound without this wire. So they bring only this kind of small, tiny little piece. And then they will use whatever, the iPad or Samsung Galaxies to monitor the ultrasound. This is not the technology for the future. This technology has been developed already 10 years ago. It's because of this commercialization, it took quite a longer time. Perhaps you don't know about this, When I introduce this medicine for the elderly people, they get crazy. Because this is known to be a perfect medicine for the joint problem. Your father or your brother or the elder brother or sister, they might have all the problem with their joint. And the orthopedic surgeon was so afraid of this medicine because this medicine, well, may take their job away. So this medicine was known to be a perfect solution for the joint problem. There was in the past. There were dozens of clinical trials going on. The half of the result of that clinical trial said it works. It works nicely for the joint pain. And half of the result of this clinical trial said it doesn't work. No effect, no impact, no nothing. So it was kind of amazing result. One group said yes, one group said no. So some doctors traced it, what happened, and realized that the half of the group which said yes, the fund was financed by the companies. And another group which said no, it doesn't work. It was public fund financed. So it depends on who financed that clinical trial. The result has been completely the other way around. Perhaps you don't need it, and you don't need yet, but I take the medicine for high blood pressure. Statistics said this drug, this medicine works only half. So I'm not quite sure whether my medicine works for me or not. Whether this medicine really nicely worked for me to reduce my blood pressure, or I just had this placebo effect so that I somehow managed my blood down. So placebo effect, have you heard about it? Not necessary to be really a professional, the medicine. If you take white powders and doctors seriously prescribe you that it works perfectly in your problem, normally it works. That we call placebo effect. Who is she? What happened to her? That's right. She had a very, very high risk in breast cancer syndrome. So she took away, not she took, but somehow she got the operation. Now the risk has been reduced from something 87% to all the way down 15%, which is in a normal rate. So now, or in the future, it will be a really, really individual-made medicine, individual solution. So far, it is too expensive to have genome sequencing. It cost 10 million US dollars in the past. Now it is about 1 million US dollars. And it becomes less and less every day. So the interim solution is that from the history, you already understand which part of your body is the bottleneck. There must be some areas which is weaker than other areas. And you focus that areas so that you have a genome sequencing on that particular area. That is what this lady have done. And it costs normally $500 US to have genome sequencing. And then the doctors knows exactly what medicine will help these genes to recover. This is the first medicine, this is first gene therapy developed by one small the venture companies located in Amsterdam. And this is the first the approved genome therapy, much earlier than FDA in United States. So one officer in FDA put the serious worry that with this changes, perhaps the medical technologies will undertake that of America, because FDA is too strict. They are not ready to give an approval in that kind of the advanced medicine. So this medicine attack genome gene directly to solve the problem. Perhaps you are lucky that you born quite late, but on the other hand, you are unlucky that you born too early. Maybe next couple of more decades, perhaps human being can really survive much longer. This is hips and knees. Even you have a joint problem, it's not a problem at all. You just replace with this one. This is our company's proud products from our companies. 2 years ago, '83-year-old lady, she got implanted with this chalk, which was printed out from 3D printers. What does it mean? Perhaps a company like us who produce ready-made hips and knees like this maybe no longer exist. Each and every hospital, each and every the operation rooms, they put one 3D printers, and they put the MRI or CT on the patient, and they print out the individual made, custom made joints in maybe a couple of 10 minutes. So in that respect, I'm not quite sure our company, after 74 years, may exist or not next some decades. It's really scary. I've been, last weekend, I've been in Gwangju, Gwangju Biennale. Have you heard about it? How many of you have been there? So you're too busy to enjoy your arts. It's not healthy. where I found this nice, the art. Well, they said it's art, but it's hard to believe whether it is art or not. This is just IB solutions. And instead of solution, they put the love symbol, heart symbol. And they put the smartphone for the communication. And they put a lot of small toys they play around when they were young. So that instead of giving a nutrition, not only for body, but also for their mind. So there was just, I took maybe 30 minutes to introduce about the trends. Healthcare. Healthcare is not the familiar areas for all of you, but I think it's not it is not useless to understand the general trends. So let me give you a hint or discuss what if you are interested. Well, I'm sure that it's your keen interest to develop your own career. And this is for the business administration, is that right? Or is just in general international studies? Well, you are clever to come all the way to Korea to study. So you are really interested in developing your own careers. So how many of you to develop to go to the industrial areas? None of you go for industries? Oh, then I'm the long guy to take your time. Then non-government area?
Well, I'm pretty sure that some of them are interested in multinational corporations.
Well, that is industries. Okay, then you are interested. Well, I was about to shock. So I'm sure for those who are interested in developing your careers in one of those multinational companies, I'm sure that you took your times to think about this, what kind of job, what kind of companies, what kind of industries you'd work for. So what was your conclusion? Anybody can share? I'm sure that you took enough time to think about it. Normally, the Korean students are very shy, but the students from the other countries are extremely participative. Anybody from Malaysia, by the way? None. No. Or too shy? No? China? Most of you are from China then? No? Where are you from? Where are you from?
Me?
Hmm?
Romania.
Romania. You?
I'm from the UK.
UK. All right. So it's not necessary to be from Asia Pacific, but also all over the world. Okay. Is it the case? You may know how famous university you are in, Korea University. Is known to be a best university in Korea, at least. Sorry, well, this slide was designed for the Korean students, but never mind. The Samsung, they took a lot of foreign employees nowadays. Even the foreigner has some kind of advantages to get into that companies. My son, who is 28 years old, who graduated this university, Korea University, is still jobless. Simply because that he just keep aiming these two companies, no compromise. The problem is that it's not only my son. My son is not the only one who wants to get into the Samsung or Hyundai. It looks like that it is even more difficult than the national exams to become a lawyer. 1 out of 100. Then no other choice but to compromise a little bit. So top 10 companies, but hopefully still 재벌. But also I found these articles from the newspapers recently. How many high chance to become a president among the top 30 conglomerates? One out of 10,000 people, more than 10,000 people. So either you take these top 10 or top 30 companies, or you better give up to become a top. So finally, any company accepting me. But still, keep searching for the better opportunities. I pretend to work hard, but I put the antennas outside of the companies, whether there will be the better companies to give to give a job or not. Perhaps you are in a better position when you get back to your home countries. The competitiveness may be softer, that I don't know. Maybe in UK, definitely, there are some other opportunities as well. The another option could just keep staying at the school. Be a student better than jobless young person. So that is given circumstance. You have, at least Korean students have no way to get away from this circumstance. So what to do? Well, you still have a choice. I skipped this one. The Richard W. Lilly, he is the Secretary of Education in U.S. Top 10 jobs require 2010 didn't exist in 2004. One more. Average life expectancies of Fortune 500 companies has declined from around 75 years, half a century ago, to less than 15 years today, and heading forward 5 years if nothing is done. It's scary. So what I'm trying to say was that the most of students prepare a top companies, good companies, or great companies, or good companies, or strong companies, whatever. This good company certainly took minimum 10 years, except for those companies like Google or these IT companies. They need 10 years to become strong. They would need 10 years to become great, so that the company can be attractive to the new challenges. Then statistically, after 10 years, this company can last 5 more years, only from the statistics. So you have chance to work another 5 years. And 10 years later or 15 years later, this company does not exist in the world. So if I were you, the most important criteria to select a job or select a company or select industries is sustainability. This industry or this company will sustain 30 years when I become an important manager after 20 years or 30 years, so that I can really contribute something to the companies or something to the industries. Hopefully that industry still exists. So first condition, first criteria is to select a new job. This company must be sustained. In that respect, Samsung Electronics would exist 30 years. How many of you believe that Samsung Electronics will exist 30 years from now? All the remaining students, you don't believe that Samsung will exist. Any volunteer? Why? Any volunteer? Okay. Yes, please.
So when I was very young, the companies that were quite big were people like Spectrum and Atari. They were like the Samsungs of the day, and they're not around anymore. That's my.
Sorry, once again. Yeah.
Spectrum and
Huh?
Atari. Do you know these companies?
Which one?
Spectrum. Well, exactly. That's my point. Like, when I was young, these were like the Samsungs of their day, and nowadays they're nowhere to be seen.
Exactly. Yeah. Okay.
Companies come and go.
All right. Good. Good point. Anybody else? Okay.
Well, right now, Igoni is still in charge. He's getting kind of old, and his health is declining. And his son, he has a smart son, but companies can only go so many generations. Some go 3 generations, but they rarely go 4 or 5. So you have to have, and in Korea, it's about family and genes. They like to keep big companies in the same family. So
Interesting.
you may fail in the genetic game.
Very interesting. Well, we need to talk. We need to talk. Well, interesting story. Well, but I know that this is not the time to discuss about the sustainability of Samsung. Samsung definitely was the good company when I was young, when I was at your age, so that many of friends of mine admit Samsung. But those days, Samsung, those days is completely different of Samsung of today. That time, many friends of mine, they didn't join when they were put to the Samsung Electronic. That time, nobody believed that Samsung would overtook Lucky. Nobody believed that. And that time, the most favorable the company within Samsung was Jail Jedang, CJ nowadays, and Jail Mojik Textile. They were so happy. But they all retired when they were early 40s. So whether Samsung will exist 30 years later or not, that is not important. The most important thing is that this uncertainty. The people were not quite sure. And nobody can really sure whether Samsung can survive or not. So here, my advice is there any industries which make so sure that it will exist? And have you seen, in order to get into the company, it is already 1 out of 100. So all the genius guys, all the smart guys will be in Samsung or Hyundai. And from the normal statistic, it is 1 out of 10,000 people to become a CEO. And these 1,000 people are already selected peoples, the best, the talents in the countries. And how you are so sure that you become a CEO among those talents. So the competitiveness internally or externally has to be less. Make your life more safer, more beautiful. And it has to be future-oriented. It is my criteria. Anybody can make your own criteria on your favor. And I like the industry which valued a people. And I'm sure that the industrial age is getting moved toward to the knowledge societies. So companies fit more into the knowledge societies. And even all the criteria are all met. I don't think I work for a tobacco company, for example. So this company is good for social benefits and human being. So I wouldn't mind whatever criteria you generate. Don't jump into the name of companies immediately, intuitively. You select your condition first. And you put your condition here. And then you put all the industries you know. Or some industries which not exist today, you may imagine which meets the requirements of here. So I gave this matrix many young students. Give us some point here, 1 to 5. It was coincident that healthcare get 24 point. But even healthcare, there are so many other sectors. It could be a doctors, it could be a nurse, it could be employees, it could be authorities and insurance and pharmaceuticals and medical device. I did the same things. And of course, the practitioners, the doctors' job get the highest. But of course, not everybody can be a doctor overnight. That is even more difficult to be an employee of Samsung. And then the medical device get the highest, the second highest, the scores. Definitely medical device, as long as human beings survive in the earth, the business will be sustainable. And the medical device, it is still less competitive. Well, although I introduce all the latest technologies or coming emerging technologies, but that technology is still, let's say, boring compared to all these IT technologies now we are hearing every day. The technology has to be late, not because we don't have a technology, but we are taking care of human lives. And as I explained, FDAs, all the health authorities make so sure the product is safe. In a way, that disturbs industries to develop faster, but on the other hand, that protects industries to sustain longer. And that makes competition less. So as this gentleman explained, he introduced a few names, strange names, which nobody knows. Well, I have 100 names which are not exist, but those names are the most attractive names those days, 20 years ago, 30 years ago. The one thing was that all the companies existed 20 years ago in medical healthcare, in pharmaceutical. Pfizer is still Pfizer. Bayer is still Bayer's. Merck is still Merck. Which means one side is boring, one side is much more safer. And it is very much future-oriented. Here, the pharmaceutical is as good as medical, but pharmaceutical, the competition is even more tougher. So someone said this is unfair because this was made by HD, who has been working for medical for 30 years. I gave empty papers, and this guy put whatever according to his criteria, according to his favors. And strange enough, the result was not much different. So once industries were set, you select industries, perhaps you value this scoring system, looks like quite systematic, so there's no reason why you refuse it. So if you select medical device as your future goal, future career path, then next, what company would be the suitable companies for you? the B. Braun, the very reason, the ranking, it's not the big size, it's not pretty much on size. This is patient perception, which company is the most attractive companies or has the best image. B. Braun number 8. In Germany, I know we are German companies. This is our B. Braun office, Korean office 10 years ago. Today, our office is even much, much better. This is what I believe. So that I provide the opportunities not only for me, but also my employees to enjoy it the same way. So in such a small companies like 120 employees, we have that many hobby teams. We are not only playing, but we encourage people to keep asking and asking and asking. The curiosity is our engines to growth for the futures. Okay, some more slide, but as I mentioned, it's not necessary to go through. I'm afraid whether you have more questions, as you are very gentle, the students, or so. Please.
I'm curious about your personal history and how you came to work for Braun, and how you worked your way up to the position you're now.
Well, the professor all just introduced. I believe myself, I misunderstood about myself. I thought that I'm very, very entrepreneurial already when I was the students. So before I graduate, I decided to establish a company, trading companies. That was year 1959. You were in the earth, or? It didn't take long to realize how stupid I was. It was extremely difficult to find small area where I can have my business. Wow, this is the business that I can persuade. So that I made some studies. Somebody went through 10 years ago, 20 years ago. So, well, 2 years, I really had a hard time in my life. I sold my the old cars that I couldn't afford to buy gasolines, the gas. Finally, I found one company from East Germany, Carl Zeiss Jena. This company is famous in optics. I mean, Germany is anyhow famous in optics. But since the company is originated from East Germany, no one touched it that time. And can you imagine, early 80s, it was really iceberg. No Korean ever had entered this countries. And I'm the first one who tried to get in. And then I got the business relation with these companies. And that time, the Europe was considered as a strange country. Not strange, but was not known familiar countries. the Korea is so much U.S. oriented. So market is completely developed in an American way. So still those days, Europe was far away. So I was lucky to develop the European companies to represent those companies into Korea. That time I still have a chance. So by already 1980, middle of 1980, this company can be grown the size of 50 employees. Can you imagine, as a trade agent, 50 employees is sizable companies. And then what happened? 80s is 90s. The Germany was reunified, so that I lost my jobs, lost these companies, Carl Zeiss, Sienna, which has been taken over by Western companies. That is the reason why I decided to become an employee of B. Braun. And the beauty of B. Braun was that when I was entrepreneur, it was really exciting time that I developed my life by myself. But no matter how much I grow the companies, the size is still small, size of 50 employees. So I had some kind of desires to manage some sizable companies, some 1,000 employees. And this desire was realized when I became the Asia Pacific president, where how many employees? You see, this was the whole territories that I was responsible. Altogether, the internal, the product to export all over the world, that was 500 million worth of business, the size. And third-party sales was 860 million, so altogether, you can imagine. So, and with more than 10,000 employees. So that was, let's say, sizable, acceptable size. Now I'm enjoying my peaceful times with 120 employees. Any other questions? Well, all of a sudden.
I'm just wondering, since I'm interested in development cooperation, so since you have very developed technology, right? So do you share or transfer some knowledge or technology to developing countries or low-income countries?
Well, these healthcare technologies, together with the convergence with ITs, which the Korea is known to be top countries. This technology it fits very much into Korea. Well, that was the reason why the Park administration, they promote so much on healthcare sectors under the name of 창조 경제, or creative the economy. One of my motivation to be in Korea after serving the AP, I really want to develop the Korean technologies. Koreans are known to be very, very entrepreneurial. There are lots of small emerging technologies exist in Korea, and they have absolutely no idea how to professionally commercialize their development. And number two, how to export into international market. So B. Braun certainly can do something to help them to further develop and to export Asia and Europe and to the world. So that is my now the last missions that I have in Braun, Korea. And we are working the several projects. Okay, last. Okay.
Is there any prior action different to other companies to prevent infection from using medical devices in Braun?
Well, there are many because, as I mentioned, our mission is safety. Your safety is our mission. So whatever we do, whatever product we develop, the first thing is not function. First thing is safety. So we have a firm belief that safety is our future. Function comes later. Functionality comes later. Okay, I thank you very much and hope to see you again.